company that is actually based out of New Jersey. And we have two products that nobody else manufactures, and I'm actually here to talk about one of those today. And what it is the Icon Resin Infiltration. Has anybody heard of this with it? Okay, perfect. So, has anybody actually done this procedure? No? Yes? Kind of? Okay, perfect. I'm not very techy, so I apologize for this stuff over here and things like that, but it is what it is. Now, what I do have is, what exactly is Icon? And so here's some notes down here, so if you guys kind of want to glance at that as well, it's just kind of adding to everything else. So, Icon is a microinvasion treatment option that uses a low viscosity resin infiltrant. So we have the Icon Proximal and we have the Icon Smooth Surface. We do not do the Icon Vestibule anymore. That is no longer part of it. So I have a few samples of those for you guys that I will just kind of pass around the kit so you guys can kind of take a look how a kit comes. So when I'm kind of talking throughout, it'll kind of all make sense if that kind of helps with you guys. So the smooth and the proximal, they are pretty much the exact same, except part of with the proximal, it actually has some wedges in there and things like that. But other than that, both of the kits have the same material in them. So I will kind of start passing that around, and you guys can take a look at them. You can open them up, that's fine, with it as well. So what's so great about Icon? Basically, it improves aesthetics. It has the ability to treat upon discovery. There's no drilling with it. There's no anesthesia. You can do the treatment in one visit, and it preserves healthy tooth structure. So when we say one visit, you are able to do about 4 to 6 teeth with each kit, and it takes about an hour to an hour and a half to do the procedure on a patient. So about 20 years ago, most dentists would have defined caries as tooth number 5. Cavitation was necessary to fit the definition. We now know that the white spot on tooth 2 represents caries and must be dealt with using an all-inclusive, multifaceted approach to the problem of caries progression. So Icon Resin infiltrates the lesion's pores, blocking the demineralization acids through causes of the lesion to grow deeper and larger. Icon stops lesion progression by setting up a barrier. It also improves aesthetics by replacing the enamel with the infiltrant, making the lesion disappear. Infiltrants have a high penetration coefficient, allowing for the complete infiltration of the lesion body. Icon can penetrate up to 1,000 microns into the lesion body, establishing a diffusion barrier to arrest lesion progression. Clinical evidence has shown that well-sealed restorations are less likely to fail due to secondary decay. Here's a before and after photo. They were treating the white spots on tooth 8 and 9, and then after Icon, this is the final with it. As light passes through a medium, it bends according to the refractive index of the medium. As light passes through sound enamel, it is deflected or refracted only slightly by a very small amount of air. As the inclusion of the air with a marked difference in RI index affects the passage of light. The thin layer of remineralized enamel on top of the lesion allows light to pass without refraction. However, the underlying lesion is very porous and contains a large quantity of air. The light is highly refracted and appears much whiter than the healthy surrounding enamel, which is the white spot. The Icon resin has a refractory index close to, but not exact, of what the healthy enamel looks like. So when the lesion is infiltrated, the Icon replaces the demineralized enamel, and the tooth looks much more like a healthy tooth. Remember that the benefit is stopping the lesion progression, but it also improves the aesthetics, a great benefit. So by doing the Icon, the light lesions disappear about 85 to 95% disappears. So just a few things that Icon delivers. It prevents further progression. It preserves healthy and hard tooth structure. It reinforces and strengthens. It minimizes risk of secondary decay, and it improves the aesthetics. And then you're able to not actually, with the hard tooth structure, no tooth structure is actually lost in the process. So case acceptance is very, very high with the Icon. And so here are 6 different things that could possibly come into the office, and you're wondering, would these cases, could I actually be able to treat them with Icon? And with all 6 of these cases, it is yes. So case selection, again, super important. Icon can treat lesions caused by demineralization from bacteria, fluorosis, hyperplasia, trauma, MIH, and developmental lesions. So with the case selection, lesions from erosion, you cannot treat this. You will actually have to go ahead and go into and do a filling on it. So what is critical to the success of the Icon is, right here is the etch that we use that's in the kit. So it is, it's not your average etch that you guys use when you bond brackets on or do any fillings. It's actually etching that's diluted with HCl, and it's at a 15%. So this is if you would etch with your regular etch, and this is actually etching with our hydrochloric acid at the 15%. So another thing that is very important when doing one of these cases is that before you even start it, you do need to go in and actually take either pumice to the area. You need to take a disc, something like that, to kind of open the pores of the tooth, and then you would start the process of it. Transillumination is a whole spectrum of high intensity light, merely focused to use light to penetrate the tooth structure and permit the identification of varied tooth density and light scattering to identify caries. So as the light scatters passing through the lesion, it appears darker against a light background. So what actually that means is when you are doing the second step of the Icon dry, you actually, when you place the Icon dry on there, you can take your light, your pure light, and behind, and then that's the whole lighting of it, and you can see kind of the difference of the spots. There's another photo of that as well. You can see this area. Let's see, here are some of the examples of if it had caries, the hyperplasia, the fluorosis, and then the MIH, how it looks normally, and then with the light behind it. So kind of how to start the Icon process is that you would, again, need to go in with a disc, a medium disc, or even if you have pumice paste would work as well with it. So you would go in and open up the tubercles of the tooth. Then what we recommend, depending on where the spot is located, if you guys do like a dental dam, that works if it's up against the tissue. If not, you could do like a liquid rubber dam There's a lot of different companies that actually carry this. They also come in like your Zoom, if you do any Zoom whitening or anything like that, if you would offer that later on, you would, there's the liquid dam in there as well. You don't always have to place the liquid dam, it just kind of depends on where the spots are located on the tooth. Then what happens is once you get everything ready, we do also recommend doing like a cheek retractors. And then if you have like a bite block that they can use as well to kind of help them stay open. The thing is the procedure total, once you get everything ready, and depending on how many teeth that you actually do, the procedure probably lasts about an hour. So everything does have to stay very, very dry for it to work. So you try to make the patient as comfortable as possible. So what you would do is you would apply the Icon Etch. So you leave that on there for 2 minutes. With the Icon Etch, there is, if you see when the kit was passed around, the tips are a little bit different that are in the package. And the tip for the Icon Etch is actually kind of like a brush. Another thing with how it comes is it's not push, you actually have to twist the material through. And so they do the whole twist thing because it actually helps kind of control the material a little bit better. So I always recommend taking the etch when you have it and kind of not tip it upside down, but tip it so it's pointing up and then do a few twists, and then you can kind of start to see the etch kind of bubble out. You will place the etch on the first etch. You would go ahead and actually etch the whole tooth. We do recommend it being on there for 2 minutes, and then every 30 seconds taking it and kind of scrubbing it, and it helps kind of reactivate the etch. You will rinse after the 2 minutes. I do recommend if you have like a suction for like a surgery suction, that works very, very well, that you're able to just kind of go up around and take the etch off and then rinse it, just because it is an awful taste. And then what you're going to want to do is you go ahead and apply the etch again. This is the second application. It's the same thing as the first. You go ahead and leave it on there for 2 minutes every 30 seconds. Typically do not start the 2 minutes until you have all of the teeth etched. So if you're doing 2 teeth, 4 teeth, 6 teeth, don't start it until you are finished with, let's say, the 6th tooth, and then go ahead and start the 2 minutes on it. Then what you will do is you will rinse. And then this is the watch for the change. So it's very, very dry. The tooth is, you can kind of see the difference in the colors and everything. Then what you place is the second step. And the second step is what we call the Icon Dry. The tip for the Icon Dry is the very thin, pointy kind of tip that's in there. And you just turn it one time, and it basically just, you put it in like the center, and it just flows into the tooth. And then you let that sit on there for about 30 seconds. And once you do that, then you would go ahead and you would take your Cure Light, and you actually, that's where you can do the back side of it, and that's how you can kind of start to see the change of the transillumination with that. So, let's see, then once we do the dry, if everything looks great, you don't have to do anything, you don't have to rinse the dry off, you don't have to do anything like that with it. Then what you would do is you would come to the final step. And this is where you place the infiltration. So also, this tip is also, you use the scrubber on this one as well. So what you do is you just turn it a few times. It's very liquidy base. You will see it, and then you just put a dab on the center of each tooth. Then what you do is you let it actually sit on there for 3 minutes before you do anything. And then once the 3 minutes has come to an end, you can go ahead and just place a little bit of floss and just make sure the contacts are open with it. And then what you would do is you would go ahead and you would cure it for the 40 seconds. And then you would go ahead and place it again and let it set for 1 minute, the final stage. And then you would cure again with it. So that was kind of a super fast little with the icon. So this is for the anterior teeth, which is the Icon Smooth is what you would use for any of the white spots with that. Then we have, then we would go ahead and start with, you can take a polishing disc to it at the very, very end. A lot of times you'll ask the patient, how does everything feel? If you don't want to do the little, the disc, you can also do like a Profi polish cup with it at the end. It's usually, it doesn't bother them. It usually gets in between the mesial and distal and things like that of it. So you just want to go in and make sure that you have that kind of, that there's not any issues, that they're able to do the flossing and things like that before they leave. Here is another kind of before and after with it. And then here we go back to replacing air with Icon. So the all the slides from before, here's kind of the science of it. So now with this case, I would definitely do a liquid barrier with that, just because it is up against the gum line. The edge will burn the tissue just like it would like in a bleaching case with it. Now you can see that the final result is that there is still a few little areas of the white on there. Icon is not 100%. Icon, so you want to always, I always tell everybody, you want to set the expectation for the patient. It is not going to be 100%, but it's going to be anywhere between 80 to 90, maybe even 95%, depending on the case of it. So you just want to just set the expectation for the patient. And so here's another, I have several of before and after photos. So this is an excellent patient for that. So the Icon is very, very popular with orthodontists when the braces come off with them not brushing their teeth very well. Icon is amazing at actually removing a lot of those spots. So here is the after. Here it is up close. It also does break down along the gum line as well in the posterior. Here's before and after close. Here's some more before and after photos. And then on our website on DMG America, we have tons and tons of before and after photos as well. Here's before and after. Now we can go into the proximal of Icon. You do it pretty much the same way that you do this smooth surface. The only thing, there's a few things that are different, and if you were looking at the kit kind of up close, you would see just how you actually place the material with it. You want to always make sure if you're doing the proximal, you want to make sure that that you do have enough space. So if you're trying to, if you need a little bit of space and stuff like that, placing a wedge, you could do a wedge. You could also do a spacer, like if you have like the bigger blue spacers that you put on there, you let that sit for about 15 to 20 minutes, and then you can remove it and do it that way. That gives you enough space with it. Let's see, so we have, there's the space from that. Also, it's very, very popular popular, the proximal, in pediatric offices. A lot of times, let's say like 3 has a mesial with a little start that they're about ready to lose tooth A. So they'll go ahead and extract tooth A, and then they're able to, they don't have to have, they'll already have the space there, so they'll just go in and do the mesial of it, and not have to destroy any of the occlusal part of it. So that's very popular in the pediatric world. Here is a patient. You can see that they did not do a great job flossing their teeth and has lots of starts of some decay with that. Icon is amazing, but we only recommend doing it an E1, E2, or D1. Anything D2 or D3, you would have to do a filling with that. So they always say, like, the wait to see approach is, you know, go ahead and floss. It's just kind of the start of it, but we'll wait and take x-rays in 6 months and see if it has broken through and we need to do a filling. Well, with the Icon proximal, you don't have to wait. You can just go ahead and treat it. So again, with the proximal, I would recommend, no matter what, doing a dental dam on there with it. The kit also comes with several wedges, so you are able to do that. We also manufacture this mini dam that actually does 2 teeth, so you don't see that everywhere, but we do manufacture that, and so we have a lot of pediatric offices that will do, when they do that on little kids, they'll do the mini dam instead of having the whole clamped on there and things like that. The mini dam does stay, but you do have to wedge it. So this is still supposed to be a treatment that you don't have to use any anesthesia with it, so you still want to be careful when you are placing the dam and the wedge and things like that. There might still be a little bit of, the patient might be a little uncomfortable. I mean, let's be honest, spacers sometimes hurt, right? So here we go. This is kind of the same thing. This is the application of the etch. So with the etch, with the proximal, you have the little barrier, so it's just etching the mesial or the distal of whatever tooth guard only comes out one side, so you do want to make sure that you do have the tip on right when you are etching the tooth. Let it sit on there for 2 minutes. Then you rinse for the 30 seconds. And then with the Icon proximal, you only etch 1 time. With the Icon smooth, you etch up to 3 times, but with the proximal, you only have to do once. Then you place the Icon dry. And then you go ahead and place the resin, and you let that sit there for 3 minutes. You light cure for 40 seconds. You go back and do the 3rd step again. You let it sit there for 1 minute, and you cure it again. And then you can go in there and do the finishing with a quick disc if you want, just to make sure they're not feeling anything and they're able to still floss. So in conclusion, some of the things that are great about Icon is you don't have to wait and see what happens anymore. You can go ahead and start treating those if you want to do the proximal. With the Icon Smooth, it does treat white spot lesions, and you're able to do that in 1 single office visit. And then we have things to make sure that the process is very successful. The number 1 thing is you do want to make sure the area is 100% dry. Another thing is that you do also want to make sure that you have enough separation in between the teeth when you do the proximal. And then it's very important to follow the directions. The directions are on the box. When you open it up, you can see the directions right there with it. So that is very, very, very important. Another few things that are in the, in here that I just like to share is this is still considered a, there is a code that you can use to bill insurance with it, but insurance still considers it to be cosmetic. Whether you do the proximal or you do the smooth surface, they still think it is cosmetic, so they will not pay. Everybody asks, how much do we charge like a patient that would come into the office? So usually what everybody charges is about what a one surface filling fee is. So you're looking at, you know, when you go out to private practice, you know, $100, $150 to $200 per tooth, times how many teeth that you do with it. We're hoping in 2026 that insurance will actually start picking it up, but as of now, they do not. Now, that was a lot of information in a very short amount of time. I know I'm kind of taking up your lunch break. Does anybody have any questions about the Icon product? Yes.
How soon after like taking off braces do you recommend?
So if their home care is great, you can do it within a few weeks. And then another question that I always get asked is, can you bleach your teeth? Because a lot of people will get their braces off and that's kind of the first thing that they want to do. So can you bleach and do Icon? Yes. So I recommend doing the Icon first, and then 2 weeks after that, you can go ahead and do a bleaching system. If you do the bleach before the Icon, typically what happens is the white spots in the area that they are really worried about, they become very, you know, it's like that's where their eye goes. It's very, 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 very bright right then and there. So I always kind of, you know, tell them to wait about 2 weeks after that to do the bleaching with the Icon.
If they have bad hygiene, then that's why they don't.
I would wait just because the thing is if even like if you just barely touch it, like let's say you're having to go in and just floss the tissue and stuff like that, and then it starts kind of hemorrhaging and things like that, that'll ruin the whole process. So,
So just another gingiva.
yeah. Any other questions with it? Yes.
When you were showing the transillumination
Uh-huh.
and you were showing some fluorosis,
Uh-huh.
can you correct fluorosis
Yes.
lesions with it?
Yes. So I do like always do a thing that, so like they're like if somebody's like, you know what, I actually wanna start putting this in my office and do it in my office, I will always come and do like a chair side with them and take one of my kits and we will do it like on a family member or a staff member or something like that, just so they can kind of see, you know, and as long as they don't like us talking over and things like that, the patient knows what's going on, kind of like a training thing, with it, but yeah. But it's an awesome product. Again, you wanna set the expectations to the patient, cause it is not 100%. So this is a product that will get the patient, you know, through adolescence, through, you know, maybe even college, before they're gonna maybe have to do like a veneer on that tooth or something like that. But it is a great thing for anywhere from little kids. I just did an Icon on a 5-year-old. So 8 and 9 had popped through and had a lot of discoloration and stuff like that on there from a trauma. And they sat there, they did a great job, and it was about a 90% improvement, and the mom was super happy because, you know, everybody was kind of, why do you have that white spot on your tooth and things like that. So you still want to make sure that it's somewhat affordable for the patient too, but if they know if it's, you know, several $100s or whatever and it's going to last, this is a process that you do not, you don't ever have to do Icon again. Once you do it one time, you do not ever have to do the procedure again later on. Any other questions about anything? I do actually have some handouts as well that you guys are more than happy to kind of grab with it. We have, and I can send you to a website that we have too that has, so if this is like a procedure that you guys start doing and things like that when you get out into the world, and so there's like a lot of people will Google like white spots and how to treat white spots and things like that. And so if this is a procedure that you start to do, it'll actually take you to your guys' website. Like if you put this on there that says that you guys do treat this with it, and so then it just kind of helps with it. But I have a lot of handouts on it and things like that, and you guys can take a look